We are at the end of the DNS level 1.
Mm-hmm.
We wanted to take the chance to kind of review
Mm-hmm.
the way of thinking of progressing exercises
Yeah.
in the DNS.
Mm-hmm.
So if you can kind of take us through the stages that you apply, it would be great.
Okay.
Do you start with the breathing? Do you start with the developmental positions? Which one? And so on.
Okay. So, as I said in the course, all the time, because the sagittal stabilization is the base, I can start with respiration, postural function, and these both function of diaphragm together. And you can start it in the sitting position, you can start it with this in the lying position, doesn't matter, maybe in the higher position, if you can do it, if you can fix neutral position of the joints, and you know. So, but for me, I can say that with my clients, I'm starting in the sitting position. And I'm saying, you are in the bus, you are in the work, you are anywhere. So, try to go with your fingers to these places, above the groin and to the lateral dorsal part. Yes, and widen, expand to your fingers, intra-abdominal pressure and also breathing. Yes, and when you are right, when you are there, maintain in this position, free your hands, and be in this position, for example, 4-5 minutes. Yes, and do it every 1 hour. Yeah, every day. And after 1 week, it will be more automatically and more strength, and it will be good base for next exercises.
Mm-hmm.
I also give you to my client, I will also give you some other exercises in a higher position, and now it depends where is the main problem.
Give us some example.
Yeah, some example. I have the patient with shoulder problems. So I give him, for example, position on all fours, or I can start in 3 months on the belly, on the heels, with supporting function for the right hand, and the global pattern together, everything together, sagittal stabilization, uprighting, and the supporting function, neutral position of the scapula. Yes, and then I can also go to all fours. Yes, and the patient in the beginning, the patient has sagittal stabilization and sitting, and does these 2 exercises, just 2. After 1 week, we go farther and farther.
Mm-hmm. Okay. So what you're saying is, once you have established the correct breathing pattern, it is not critical in which developmental stage you start the exercise. You can start in the higher stages or the lower.
Yeah.
It's a question of how comfortable the client is feeling and where is the problem that you're trying to fix.
Yes.
And accordingly you will choose the position. Can you give another example not related to shoulder? Let's say hip stability. Yeah.
Yes.
Okay.
Hip stability. Hip stability is every time connected with your pelvis and with your trunk. Yes, works together.
Mm-hmm.
Because you have pelvis and femur, yeah, and 2 bones, 1 joint. It's also together. Yeah. So you can use the same thing, sagittal stabilization, what position you need, yeah, in the sitting. Or for example, I used to do this on the morning. You are my client, and I'm saying, you are in the bathroom, you have the mirror, and you are standing. So try to give your hands to these places, the same, and try to smile with your navel. Yes, on you. Try to smile to the mirror on your navel. And you see, this is standing position. Not sitting, but standing position. But do it the same way, the same intra-abdominal pressure. try to activate and breathe together. Then you are going to the work, you are sitting, you can do it in the sitting, yes?
Mm-hmm.
And then I have problem in the hip, so I give you, for example, this position, it's the high position. For training in this position, yes, it's hanging stance.
Mm-hmm.
Or I'll give you the position of tripod.
Mm-hmm.
Yes, these are high position. But when you have sport 1, exercise 1,
Yeah.
you can use position on all fours, bear, squat.
Mm-hmm.
Yes, when the hip is in supporting function.
Right. Okay, great. I actually had one more question. Can you give some tips for implementing the concepts
Mm-hmm.
in the group training? Because it becomes more tricky because different people, you haven't done assessment to everyone. So how do you work that in with the group work?
I also said that for my practice, I send to the group clients who are after 3 individual sessions,
Mm-hmm.
because I know that they a little bit knows how to activate it. When I send them for the first time,
Mm-hmm.
unkissed people, unkissed DNS.
Yeah. Untouched DNS.
Untouched, yeah. I know that will be more working for the instructor in the group, and still fixing something.
Right.
Yes.
Yeah.
After 3 sessions, the patient a little bit know what is sagittal stabilization, what is neutral position for some joints.
Okay.
Yes.
But let's say I'm an exercise or fitness coach,
Yeah.
and I want to take some of the principles of the DNS into my group lessons. I have not done assessment to everyone.
Mm-hmm.
I have not done.
No,
But
no.
I want to introduce the group to correct breathing, to some developmental sequences.
Yes.
How do you suggest?
You can also do with untouched people.
Yeah.
Yeah. But you have to reckon that it's more it's difficult.
Yeah.
Yeah. But I said I'm not so strict on the beginning when I have the group.
Yeah.
I'm not going to the details so much. Yeah. And I'm glad if I improve 20%. Yes.
Mm-hmm.
Yes, the global pattern in 20%. Example, I have big kyphosis, and after group session, the client is more straight. It's for me 20% from the global pattern.
Yeah.
So I'm satisfied.
Mm.
And the next time, I can do more. Yes,
Yeah.
because he or she knows this is better, this is okay. So I'm going to the next segments, and after sometimes it's connected
Slowly. Yeah.
slowly.
So you have no problem to include some developmental sequences in group training to
No.
gain some improvement, even if it's not
Yeah.
100% one-on-one.
Mhm,
Yeah,
mhm,
it's
mhm.
better than letting them move in the wrong
Yes,
way.
Yes,
Yeah.
every moving is better than nothing.
Yeah.
Yeah, and also you have some people with very good mirror neurons.
Yeah.
They see
Yeah.
and they can
Copy.
repeat it.
Yeah.
Copy. Yeah. So for these people, it's easy to do the same thing and be better.
Mhm.
And then you have people, they are not so handy.
Yeah.
Yeah. And they need handle,
Yeah.
they need fix.
Right.
Yeah. Or it takes longer.
Yeah.
Yeah, longer time.
Okay, great. Thanks so much.
It's for you.
See you again
See
in
you.
July.
Yeah. Bye.
Bye.